Everybody, please start typing your questions, or you can ask me directly also. What kind of questions you're going through in your mind at this moment before you start the class? नीता जी बताइए कुछ. हाँ, मुरुगेश सिंह जी बताइए. Anything from your side?
Hi, good evening. I
Hello.
hope you can hear me.
Yes, I can hear.
Can you hear me?
Yes.
No, the only question that is running in my mind is, how am I going to cover this in 15 days? And, in 1 hour session. I think the magnetic therapy is not a very simple thing. It's
Yes.
definitely, we're utilizing energy and points and other things. So
Yes.
it's just, it's just running in my mind.
Okay. Okay. Very nice question. To start with, this is, we have to make sure that how and how long it will take for me to capture anything which is very new. Before I answer that, is there anyone who is practicing any kind of energy healing modalities, any kind of like acupuncture or say practice? Yeah, practice. Definitely, you should definitely acupuncture or say Reiki or even yoga or anything which is like you have been. Is there anyone who is practicing something like this? Okay.
I'm practicing, Kriya Yoga.
Kriya yoga. Okay. 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 Neetaji, what you're learning?
I practice Marma Chikitsa.
Okay.
For my personal issues.
Okay.
I have been in contact with a Marma Chikitsa.
Where did you learn before?
Yeah, I mean, he has given me certain things for my ailments. And I practiced it and I found it a lot beneficial. So out of curiosity, I joined this course.
Okay.
Let's see. Yeah, but I benefited a lot from Marma Chikitsa.
You will definitely. There is no doubt on that. You will definitely get benefited. Anybody else? I also practice. Anybody practices acupuncture, acupressure, sujok, Reiki, this kind of modalities?
Yes, I am practicing yoga, Ashtanga yoga.
Okay.
So since last 1 year, I am practicing.
Okay. Now, so before I answer that question, how you're going to cover everything, first of all, I want to mention what we are learning. We are learning something called energy medicine. Okay, the overall concept, the bigger umbrella is something which you can call it energy medicine. Okay, so we have different kinds of medicine, starting from your herbs. You have now there is I don't know, like obviously the modern medicine is there. Then we have Ayurveda, we have then Unani, then we have Greek healing modalities. Out of everything, we can call it energy medicine. So all acupuncture or the Marma, similar in a context, okay? Because this is based on some energy centers. The word, please remember, energy centers and energy channels. Okay, so this whole therapy is about learning energy channels and energy centers, which is also we learn mostly in acupuncture or acupressure. So here in our say now in acupuncture, I will show you something. So this is the model for acupuncture, and if you can see, there are some lines. Okay, there are some lines, and on that lines you have some points. Okay, yeah, please keep everyone keep yourself mute so that others do not get disturbed. So what is happening in acupuncture? This is when you start practicing something like this, people do a lot of questioning, and you need to be very clear. And I see that even some people are practicing this kind of modalities. They are not very clear what exactly it is. So what we are exactly doing, according to the acupuncture theory or traditional Chinese medicine theory, this 14 channels, we have 14 basic channels in our body, and these 14 channels are responsible for almost all kind of health issues. So it will cover your whole body. Any problem in the body, you can treat through these 14 channels. Okay, so when we are healing these channels. We are not healing the points. Say now you have headache and you suddenly ask me, sir, which point I press to cure my headache? This is a very wrong or vague way of approaching any energy healing modality. Okay, reason for the headache could be many. It could be the problem with your say the kidney channel. It could be the problem with the gallbladder channel, or it could be the problem with the liver channel as well. So without diagnosis, we don't know. We will accept that we don't know what to treat. Okay, without learning the, say, if there is a problem in the side of the headache, okay, then most of the time we know that the problem is in the gallbladder channel. So this is a diagnosis. So by the location you can find out. Okay, if you have problems, say, on the wrist, okay, so wrist on the sides, now we know which channel is going through the sides and we exactly try to heal that. Now think about a situation. You have some skin disorder. Now which channel to be used, right? So in that situations, we need a little more deeper study. And in that study, we have found out that our lungs is the governor of our skin. So any treatment you want to do it for your skin, you have to treat your lungs. Okay. Now, people are in today's world, people think about a lot of facial beauty. Now, facial beauty is a matter of two things. First is obviously the skin, which is controlled by the lungs, and second is the muscle. Okay, so muscle is controlled by the spleen. So if we can energize our lung and spleen, we can improve our facial beauty. Okay, so we need to first understand very clearly how this energy channel works. And then treating the energy channels through these points is very, very easy. Because say now there are hundreds of methods. Say if I want to treat my lungs channel, okay, there are hundreds of ways we can treat it. And one of the simple method which my teacher used to say, if you treat the third and the fifth point of any meridian or any channel, if you just put one needle here, this whole channel will be treated. So we should not be bothered about too much about the treatment. We should always bother about the diagnosis. Is that clear? Can I make a foundation here that nobody from the beginning thinks about how I want to cure a particular problem. First, I want to find the root cause. So this is the story I told you about the acupuncture. Now, in our Indian Shastras, they say we have 7 chakras, 3 nadis, and Panchavayu. So these are the few things where when there is an imbalance, we basically comes up with many diseases. Okay, so if we can heal our chakras, if we can heal our Panchavayu, and if we can heal our 3 nadis, which is Ira, Shushumna, and Pingla, then we are done. We don't need to think more than that. Is there any questions from till now, if what I have explained? Okay, so we are
so 7 chakras, 3 nadis, and what is
Panchavayu. So there are 10 different. So when we take the breath inside, okay, in simple terms, it's called the prana-vayu. Okay, now when it is going inside, it can be through your breath, it can be through your physical food, or it can be through your water. So anything which is going inside, that is prana-vayu. Okay, the pranic energy. Now it will get divided into 10 different parts. So we'll learn how it is divided into 10 different parts. And then out of this 10, the 5 are very, very important. So if we learn how to heal the Panchavayus, the 3 nadis, Everybody knows about the three nadis, the Ida, Sushumna, and Pingla. How many of you know? How many of you don't know? Ida, Sushumna, and Pingla. Okay. Okay. So if we can balance this. Now, so think about a situation, a child, okay, who with seizure or any mental disorders, okay. Generally, we know that this is a problem with the Sushumna Nari only. Okay, when the Sushumna Nari is imbalanced, this kind of situation arises. So we need to learn simply how we can treat or rectify. Okay, remember, as a healer, we are going to rectify. We are not going to activate. Our job is not activating. The activation is the job of a guru. As a healer, our job is to rectify. Okay. So we are going to rectify the problem. Now say, and this is very simple. If say your left nostril is more active, you know that Ira is more dominant. Then you have problem more of the which you can say the Pingla, okay? Because the Pingla is not active too much, or the right side is not balanced. That is why you will have more disorders which is related to Pingla. Then if your Pingla, the right nostril is more active, then you will say you will have disorders which is connected to the Iranadi. Okay. So this is how we simply can figure out where is the problem. We'll go more deeper. But at the first stage, we are going to learn all the 107 marmas. Okay. So on the first 2 days, we will finish all the marmas in our head. Then next 2 days, we are going to learn the marma points in our head. Next 2 days on our feet. Next 2 days on our front body. And next 2 days will be on the back body. So in 10 days, we are going to finish 107 marmas completely. And on the next 5 days, we are going to learn how to apply these points to treat these energy centers and energy meridians or centers and the channels. Okay, if we learn that, then we can almost heal any problem. And also, we are not just going to learn about the marmas, we are also going to learn about their specific uses. Specific uses also we learn, and we'll also learn how to use them in a bigger protocol to heal our energy centers and energy channels. Okay. Yes. So what is the next question probably you have in your mind now, so that we can create a. So before we start today, I want to make sure that some of the, when we start something new, there is always there are questions coming in. What will happen? How will happen? How can I do it? How can I learn something so practical over online? Anything which is coming in your mind, please do share so that we can start as soon as possible.
Sir, I just have one question.
Yes, Padmaji.
So even diabetes like BP, because the blood is all over the body.
Yes.
So even those, because for diabetes reason can be 1 or 2 different reasons. So even that can be treated or diagnosed through this.
I feel treating any health problem is very easy. First of all, we have to understand that most of the time it is the problem with these two. Either we have problem with the in nature or the young nature. Okay, so treating the problem is very easy, but the biggest question is why a problem arises, why a health problem happens to us. And simply we can say in one sentence that all the health problem is arising in this modern world because we are living a life which is completely against the nature. How nature has designed us in a particular way to live, and that has been found out after a lot of experimentation, and that has been given and already shared by our masters or the rishis in a long way back. But some way or the other, the way we are living now, say at this moment also, it may look everything fine, but I'm in front of 5 different devices. I have my laptop, I have my camera, 3 phone, charger, and all these things are there. So when you have around so much of electrical devices, this generally it affects you a lot. Okay, and then the lights, and then the fan, and then the AC, it is endless. Okay, so somewhere the other, controlling the surrounding is not very easy. Okay. So somewhere now, so what we can control? What are the things we can control? Can we control our sleep? First, the first fundamental of the health. If you're sleeping properly, if you're sleeping deep, you can heal almost any health problem. Okay. Second, your food. Are you eating in the right time? And are you eating right time? Not what you're eating. I don't care what you're eating. Right time and how you're eating. How? Are you drinking water with the food, or you're, gulping too much? That is, we have a habit. And then even if you're not hungry, are you still eating it for any reason? Okay. So this is what makes a difference. Are we designed to eat 5 times in a day, 2 times in a day, or 1 time in a day? That is what the question is. Okay. Then comes what? Our sleep, our food. Then comes our practices, which helps us to create some energy balance in our body. The energy, this energy channels which you talked about, the energy has to move from one part to another. And if you keep sitting like this for the whole day, how the energy will move? So a human body is not designed to sit or lie down for the whole day. Okay, we are not supposed to sit in one place for the whole day, and we are almost doing it, sitting in one place more than 7, 8 hours, 10 hours. And I'm telling you, I see my mom how actively she is working throughout the day. But the problem is that she is probably in one single posture for the whole day. When she is sitting in the squat posture. When she is cooking, she is in a standing posture for the most of the time. And that is a problem. Okay, you cannot restrict it to 1 or 2 movements. You have to do multiple movements, multiple things to activate your energy channels of the body. Otherwise, the body will create stagnation. And that stagnation, what is pain? Pain is nothing but the stagnation of energy flow. Okay, so when there is a question, if I have pain here, and there is so much pain, what is this? Why it is happening? The first definition of the pain is that pain is stagnation according to all energy healing modalities. Second, it is also a sign, like we have pain in the knee. For my teacher used to say, if a woman comes to you with a pain, say in the neck or headache or pain in the wrist, it doesn't matter. First thing you're going to treat is the uterus. You have to check whether her uterus is fine or not. If there is any issue with the uterus, if her periods are in time. If a man comes to you and he is talking so many things, don't listen to him. Just check whether his heart conditions are right or not. Okay, so this is very common. Whatever you do, a woman, first thing to be treated or checked is the uterus. For man, we should always check the heart. Okay, so if you, as a man, if you have knee pain, check the heart. As a woman, if you have knee pain, check the uterus. That is one simple formula. So pain is also a sign for very complicated problems in our body. So in the first stage of any health problem, it is just the pain. Then comes the obesity. The pain, the stagnation will create obesity in the body. And the later and the advanced stages, it becomes the cancer. Okay, so it always starts with the pain and then the obesity. So if you are in this first and second stage, please start taking care of self as much as possible for you. Sleep in time, eat in time. What you're eating doesn't matter. Eat in time. And make probably 2 times a day only. Not eating at the evening, on the late evening hours, which we always do, because we have food now available at 3 o'clock in the night. We can just give a call and get an ice cream at 3 o'clock in the night. It's so easy for us. Right? So in that condition, how you're gonna stay healthy? And when we have so much problem, like it is already the multiple problems, we have high BP, high sugar, and then high cardiac, high heartbeat, then how are you gonna help? Then we go to the doctor. We do not go to a healer or a doctor at the beginning itself, when it is extremely already too many things, and when it is out of control, we are falling down, then you have to go. So you have to always see you're treating at the advanced stages, on the beginning stages only. Okay. Yes. So what is the next question? Anything about the Marma? What is Marma? Let's come to this point. Anybody have any idea what is Marma? What do you think what Marma is?
A sensitive point on the
Sensitive
body.
Points. Yes,
Yeah.
energy centers. So we have three primary definitions, not definitions as well, but you can say this is how we identify a Marma point. The Marma point, first thing is that it is sensitive or painful. So when you touch a Marma point, generally it should give you some pain or sensitivity. Second, that there is a pulsation, abnormal pulsation. When you touch the point, you will feel some kind of pulsation at that particular point. Next is, it is a junction of bones, ligaments, or many other tissues. So where there is too many combinations happening, whether it could be bone plus bone or bone plus ligament or bone plus muscles, it can be called as a Marma point. Okay, so these are the three things which you have to remember at the beginning stage before we learn the applications of the Marma. Okay. Okay, any other questions before we start? Now we can start, or if you have any questions in your mind.
We'll start, sir.
Shall we start?
Yes.
Just a minute. Just give me 1 minute.
So can we raise questions or get details of all the three nadis, as we progress with the class? We can get into the details of all these things, right?
We can definitely, we are gonna definitely learn, because without learning what is the nari and what is all this, how can we treat them, right? So we have to definitely learn about it without any doubt. What are the 7 chakras? How it is gonna affect us? All these things is mandatory to learn. Who is not, Bikashi, any problem with the voice? Just give me a minute. This tab is creating some issue. Yes, it's done. Just one minute again. Can you all see the screen which I've shared? Can everybody see the screen?
Yes, sir.
Okay.
Yes.
Yes, sir. We can see that.
Okay. Now I'll start showing you the different points and different its uses and how we stimulate them as well. So before I show you the stimulation, I will first tell you the location. Okay. Then I will tell you some indications and I will show you how to stimulate them at the end of the class. Okay. So that we do not have to just keep shifting between the screen on and off. Okay. Okay. The first Marma point, which is between the eyebrows. Okay. The name of this Marma point is called Tilarth Kalam. T-I-L till Earth. Tilarth Kalam Marma. We will not initially discuss too many indications. We'll just learn one or two indications so that we can easy to remember. Okay, if I tell you hundreds of different uses, it may be very confusing in the beginning. Okay, so we'll only learn few things at the beginning so that it do not confuses us. Now, the use of Tilarth Kalam is to control 10 bayus. Just now we spoke about the Panchabayu. So Panchabayu is a part of the 10 bayu. Now it is like the controller of the 10 bayu. So whenever it is like a point which you have to stimulate always. In any protocol, whatever is the problem, Tilarth Kalam 1 is the one which it is mandatory to stimulate. You guys can keep taking screenshots for your own study for later on. Don't forget to take the screenshots. Also, it enhances memory. Now, have you seen people, or even you have unconsciously doing this? People keep doing tapping on your forehead when they want to remember something. So it generally goes up, but when you exactly do the same tapping on the Tilarth Kalam Marma, you will see you start remembering. Yes.
Sir, will you please tell what is this Marma is called?
I just said Tilarth Kalam Marma. Are you able to? I have. Are you able to see the screen or not?
Yes, I am able to see it.
Then what is the problem which you are? Tilarth Kalam Marma. Tilarth. You have to tell me exactly if it is any technical issue or anything. Everybody is able to understood or no?
Yeah.
Is my sound and everything is clear?
Yes. Yes.
Yeah.
Yes.
I am looking on the mobile screen, so it is a very small handwriting.
Yes. So see, most of the
Marma.
Sorry.
It's the Tilarth Kari Marma.
Tilarth Kalam. Tilarth Kalam.
Tilarth Kalam. Okay, sir. Thank you.
Now, whenever there is a column, this particular word refers to the Marma point. Column refers to the points which are very, very important. Okay. So any Marma point which comes with a end, which is column, remember, it is a very important point. Everybody, please keep your audios off so that there is no disturbance from the others to the others. So this is the Tilarth Kalam Marma. It is the controller of 10 bayus and it is also enhances memory. Now, the next point is Tilarth Kalam 2. So if we measure, so there are two Tilarth Kalam Marmas now. One is here And one is 1.5 finger. Okay, 1.5. One and half finger. This is Tilarth Kalam, Tilarth 2, Tilarth Kalam 2. The energy of the Tilarth Kalam, the similar energy can be found here and also found here in both the points. The indication and the stimulation method is also similar. Now, can somebody tell me what is the length of your forehead? Length of your forehead if you measure with fingers. Length of your forehead means from your eyebrow line to your hairline. How many fingers you can figure out? How many fingers?
4 fingers.
Four.
Fingers, exactly. 1, 2, 3, 4. Okay. Now, at the 4-finger level, we have a Marma point here, which is Brahma Marma. Brahma Marma. Am I clear? Brahma Marma. So indication of this is to use for any issues related to your brain. Okay, issues for brain. All kinds of brain disorders, it is mandatory to use it. Now, if this is our hairline, this is our Brahma Marma 1. We have one more Brahma Marma at 3-finger backwards. So measure 3-finger backwards. And you will also find one more point here. If you touch that point, you will find the depression now. Okay, everybody move your middle finger around 3-finger distance from the hairline, and you see whether you can find a depression in this particular area. Brahma Marma 1, and this is 2. Okay, any technical issue as such, everybody can visualize it properly. Can you see what I'm writing properly? Is there any confusion, any doubt, or anything which is you want to share?
Sir, use blue pen or black pen. That will be better.
No, we cannot. You cannot use books. Okay, we have to use, by showing the book, I cannot show you the exact point. Everybody, please keep your videos, audios.
No, I'm saying you use the blue pen.
Blue pen. Okay, so we'll definitely use other different colors. Okay, I know that this color which I'm writing, this is sometime little bit difficult. Okay, I will definitely use the colors so that we do not find any problem.
Sir, so do we have can we use this application at least so that we can get the clear idea about all these positions?
No, this is a point. This is the application for your acupuncture only. Okay, you do not need to use it. You just take the screenshots and it will be enough for you at this beginning. Okay, so what I'm writing, what I'm drawing, this is not for the acupuncture. We will take some support, but it is not mandatory to keep this for you, because it will make you more confused at the beginning. Now, if we keep our index fingers on the ear top, okay, both index fingers on the ear top like this, and slide our index finger to the middle. Brahma Marma 2 is 3-finger backward, 3-finger from backward from the hairline. Now, if we slide our index fingers slide our index fingers to the middle, both the fingers, we reach a point which is we call Adhipati Marma. And also called Vishnu Marma. Am I clear on this? Vishnu Marma. Okay. Now, in acupuncture itself, this is a very important point. This is also in acupuncture, they call it $1 million point.
Is this also the point where Sahasrara Chakra opens?
Yes, exactly. This is the point for Sahasrara Chakra as well. Now, what is the use of it? Now, just think that there is a way to squeeze you and bring you in one point. Like you have that, we have seen this thing in Avengers, okay? They will shrink the body into a point, okay? So if there is a possibility to shrink you to one point, that one point will be this.
Point will be this. Oh.
Okay? Now, think about the power of that point. You treat this point, it will treat any conditions of the body. Am I clear? So this is Adhipati Marma. Now, from Adhipati Marma, if we go 3 finger backwards, so this is Adhipati Marma. If we measure 3 finger backwards, again, there is a depression in this point. This is Mahesh Marma. And this is the controller of hormonal functions, all the hormonal issues, okay, hormonal balances. This is the controller of all the hormones in the body. Okay, to remember, when you want to remember a particular point, you have to remember with one particular indication, which is very, very important at the beginning. So that is, it is easy for you to remember. Now, we have already learned 4 Marma points.
Hello.
Yes.
Isn't the fifth wasn't this fifth?
हेलो.
Yes.
सर आपने जो बताया ना कि ये अधिपति मर्मा, तो अगर हम वहाँ पे ये फिंगर्स रखेंगे तो अपने को पल्सेशन फील्स होगा ना?
देखिए, मैं आपको अभी प्रैक्टिकल करके नहीं दिखाया मैंने, ठीक है? प्रैक्टिकल हम क्लास के खत्म होने से पहले करके दिखाऊंगा. अभी मैं सिर्फ लोकेशन और इंडिकेशंस बता रहा हूँ. आई विल टेल यू हाउ एग्जैक्टली टू बी स्टिमुलेटेड थोड़ा सा बाद में, ठीक है? थोड़ा सा लिटिल लेटर. सो होल्ड योर पेशेंस. Okay, we will definitely show you the stimulation method.
Yeah, this is the 5th Marma point, is it, sir? 5th, right? The last one you said.
So mainly we have learned 4, which is Hilartha Kalam, Brahma Marma, Vishnu Marma, Mahesh Marma, and 2 other variations of also of Brahma Marma 2 and the Tilartha Kalam 2, which is extra, which you have to add it. Okay.
Right.
Now let's come to the face area. Okay, let's do one more Marma, which is on the back side. Now, all of you have to feel it, okay? There is no way I can, even in this screen, it is very difficult to show you exactly that area. This is the end of your skull bone, okay? तो आपको छू के पता चलेगा, आप सर को ऊपर नीचे मूव करोगे, हाथ को रखोगे और कहाँ पे आपका स्कल बोन खत्म हो रहा है और आपका सर्वाइकल शुरू हो रहा है, वो आप थोड़ा सा हाथ ऐसे मूव करोगे नेक को तो पता चलेगा आपको, ठीक है? You will be able to understand where your skull bone is ending just by moving the neck forward, backward, and placing one finger over it. Okay. Now, there is a very important point again. So if this is the end of the skull bone. Okay. Now we have 4 Marma points. 1, 2, 3, 4. So this is the central line. From central line, 1 centimeter in both directions. Okay. तो आप अपने दोनों थंब को ऐसे पीछे रखोगे और दोनों तरफ स्लाइड करोगे तो आपको उसका डायरेक्शन कहाँ पे है पता चलेगा। तो ये 4 पॉइंट जो है, दिस 4 points are called करुणा, KARUNA, करुणा मित्र मर्मा, Karuna Mitra Marma. And the indication of this is the master controller of the body. Master controller again. Is it already too much? Is it already too much which I am showing? Are you able to take things in your mind? Are you able to absorb it?
Yes, sir.
Yes.
Okay.
This is basically medulla oblongata area.
Yes, very true. So we have to know how to stimulate this area. Now, the upper two works on the upper body. Lower two works on the lower body. But the distance is very minimal. Okay, like less than even 5 millimeters. So generally, we just place the thumb in this particular point and we can make sure both the points are stimulated together. So these are few of the marmas on the central line of the head. Now, let's come to some of the marmas in our face. Or say, yes, let's go to the marmas in our side head of the head. Now, if we measure 2 fingers, okay, so this whole line or the whole area, okay, the whole area belongs to the fire element. And if we place our middle finger in this area and create a zigzag motion, it will stimulate or balance the fire element of our body. The name of the marma is called Chunambu Kalam. CHU Chunambu Kalam. These names are not very easy. Now, when you learn for the first time, it will obviously make you mad. Okay, that how I'm going to pronounce this. For me, as a person from Northeast and a Bengali speaker, it was not very easy for me as well. But I wanted to learn somehow, and with God's grace, our Guru's grace, it came to our mind very easily. So I didn't have to face many difficulty to learn this. Okay, so this controls the fire element. Now, people who know acupuncture or acupressure, keep observing what I'm doing next. The next point is on the ear, on the side of the ear. जो आप अपने कान को थोड़ा खींचेंगे, when you pull the ear, and you will see an attachment, this extra skin or the wave. Okay, there is a wave or this extra skin which comes out, which is helping you to keep the ear fixed with the skull region. This point is called Poigai Kalam. Poigai, Poigai, Poigai Kalam. This is the controller of air element in the body. Am I clear on this? Air element.
Yes, sir.
this particular point is gonna be very, very helpful when it comes to your lower back pain, lower back. Okay, अगर एयर एलिमेंट से कनेक्टेड है, एयर एलिमेंट मींस व्हाट? एयर एलिमेंट का मतलब होता है लीवर एंड गॉल ब्लैडर. ठीक है, तो एयर एलिमेंट रूल्स द लीवर एंड गॉल ब्लैडर. तो लीवर एंड गॉल ब्लैडर से जो भी चीजें रिलेटेड है वो सारे प्रॉब्लम्स में आप पोइगाई कॉलम का यूज कर सकते हो. ओके, any problem which is related to liver and gallbladder. Now, liver and gallbladder, when I say, whenever I'm talking about a particular organ, I'm not just talking about the organ, I'm talking about the whole energy channel. मतलब अगर I'm talking about liver, it will help you with the liver problems. I mean, it will help you with the eyes, because your eyes are connected to your liver. Okay, so this is slowly we have to learn which organ is connected to our which senses and what other problems and which part of the physical body. ठीक है, तो अब ये चैनल कहाँ से है वो थोड़ा हमें धीरे धीरे समझना होता है. अभी इनिशियल मोमेंट पे आप इतना याद रखोगे तो बहुत ज्यादा है, इतना ही बहुत ज्यादा है. और मेक यस
both the ears, left and
both
right.
the ears, yes. So this is one of the best point to treat lower back pain and issues related to liver and gallbladder.
Now, does this even relate to the intestines?
See, all channels are connected. Okay, large intestine and the lungs are part of the ether element. I will show you that. Okay, so when we have to figure out a connection between different organs, we have to study that as well, and it is not a very simple science. Okay, but I will try my best to make you a foundation to understand some connections between these organs, so that you can, when you heal or try to trying diagnosing some people or your patients, you know at least to do some basic diagnose from the energy point of view. Okay, so hold your patience. I'm just one thing I'm telling you, because we are in a world of watching reels, and I have been seeing this, from my last few groups. Nobody have patience. They're like, today only I want to just heal and do all the changes in the world. This is not going to happen in one day or even 1 year. So hold your patience. This is very interesting. Once you keep learning, you will see so many things are happening. Okay, now this is the corner of our eye, and this is the tragus, this area of the ear. हम जब भामरी प्राणायाम करते हैं, when we do भामरी प्राणायाम, okay, when we press the ear to close the ear, this is called tragus. Okay, तो इसका नाम है tragus, और ये this is the corner of the eye. So exactly in between we have a marma point, which is called shankha marma. And it is the controller of the earth element. Earth element का मतलब है spleen and stomach. ठीक है, तो आपको पेट के कोई भी इशू के लिए, any problem with your stomach, abdominal issues, gas, acidity, indigestion, आपको शंख मर्मा को यूज करना है. Abdominal issues. Next one, keep visualizing. Make sure you visualize in your mind, okay, or at least touch the point when I'm showing. So what you do, place the middle finger, don't press hard, you just to keep the finger and try to feel, okay, if there is any pulse or if there is any pain. जब मैं इन चीजों को दिखा रहा हूं, before I show you exactly how to do it, you have to just feel the pulsation in that particular points. ठीक है, सो हमारे पास अभी सिर्फ 10 मिनट है क्लास को खत्म करने में, तो हम 2 पॉइंट और सीखेंगे एंड देन विल मूव टू द नेक्स्ट practicals. Now, say we take a x-axis over our eyebrow and y-axis on the corner of the eyes. तो ये जो junction है, okay, this junction, this is called the apang marma.
सर कौन सा मर्मा?
अपंग, APANG. हाँ, अपंग, अपंग मर्मा. Is my writing not clear on the screen?
सर मेरा मोबाइल की स्क्रीन छोटा है.
हाँ, तो आप प्लीज अपना इसके मतलब इसको चेंज कीजिए, बिकॉज मैंने देखा है कि जो लोग मोबाइल यूज करते हैं वो लोग थोड़ा उनको समझने में थोड़ा डिफिकल्ट होता है. ठीक है, तो आप कोशिश कीजिए कोई लैपटॉप या कुछ भी आप यूज करें. ठीक है, ये जो मर्मा पॉइंट है अपांग मर्मा, दिस इज द कंट्रोलर ऑफ ईथर और द स्काई. ठीक है, तो ये आपका हो गया lungs and large intestine. So any disorders with the lung and large intestine, we're going to use that. This is called the apang marma. ठीक है, फिर one last. अभी हम आएंगे कान के पीछे. तो आप क्या करोगे, आप जॉ लाइन से जॉ लाइन में अपने फिंगर्स को रख के धीरे से पीछे की तरफ जाओगे. तो यू स्लाइड योर फिंगर्स एंड जस्ट मूव अराउंड योर जॉ लाइन. जहां पे जॉ बोन खत्म हो रहा है कान के पीछे, wherever your jaw bone is ending, that point is the point which we need to learn. And this is also, see, this is our skull bone. तो ये दोनों, ये जो पॉइंट है स्कल बोन और जॉ बोन के बीच में है. okay, it is between the jaw bone and the skull bone. So in this exactly you can feel it very easily. और इसको थोड़ा सा प्रेस करके देखिए, आपको मैक्सिमम टाइम इसको सब everybody can feel some point pain in this region. This point is called vidura marma. Vidur. So controller of the water element. Water element means kidney and urinary bladder. ठीक है, चलो अभी हम प्रैक्टिकल्स करके देखते हैं, हाउ टू स्टिमुलेट देम वन बाय वन सो दैट वी कैन रिमेंबर. Before we do the stimulation of the marmas, we have to do a gentle protocol, okay, a very gentle protocol to stimulate the energies. तो आप जब बैठते हो मर्मा क्लास में, सबसे पहले आपको क्या करना है कि आपको हाथ में थोड़ा सा ऑयल लगाना है. ओके, एनी ऑयल, कोकोनट ऑयल और एनीथिंग, सो दैट यू कैन मूव द फिंगर्स ओवर द स्किन वेरी इजीली. ठीक है, दिस इज द फर्स्ट थिंग. Obviously you have to take some stay fresh before you start the class. And if you think that your energies are not balanced and you have some issues, then take some salt water bath for a few days. Okay, salt, just put a little bit of 1 spoon of salt in your water when you're taking the bath, and it will remove all the negative energies from your aura or from your energy body. Then what you have to do, you can put chandan on the tilartha column, chandan, and on the palm. Okay, we have not learned what marma point is here, so we'll learn about that. थोड़ा सा चंदन आप लगा के रखोगे these 2 points and below the feet as well. What it does is it blocks the energy, so you will not lose energy when you put chandan in this 4 points. Okay, so it will capture all the energy which is inside you and it will block you inside and it will not let it go and not loss of energy. Okay, तो हम एक start करने से पहले एक gentle protocol करेंगे so that we can ignite the power of the energies. Okay, now everybody please stay in a comfortable state. Now you don't need to see the screen anymore. Just close your eyes for a while and focus on the third eye chakra or your Tilarthakala Marma. And focus on exhalation, deep exhalations. Your exhalation should be longer than your inhalation. Like you're exhaling from the third eye, inhaling and exhaling from the third eye. Make sure that your body is not moving anymore. Now, for just 30 seconds, do the alternate nostril breathing. So we'll close the right nostril, inhale through the left, then close the left nostril, exhale through the right, inhale right, exhale left. 30 seconds. Now, start to rub your palms. Gently rub your palms and apply over your face. Next step is to bring the hand in Mahamudra position, in the floating position, and you have to visualize that you are receiving some kind of cosmic energy on your palms. Your visualization, remember, is powerful. Whenever you visualize, you can create some physical sensation. So, आप जब visualize करोगे कि there is a ray of energy entering in your body through the palm, you will feel some sensation in this area. So, just for 10 seconds, visualize that you are receiving some form of cosmic energy, and then place it over the ears. Place it on the ears. Now join your palms to the prayer mudra. Now we'll chant the Lord Dhanvantri mantra together because he is the master or he is the giver of this beautiful knowledge, and without giving our gratitude towards him, we'll not be able to progress much. So we'll just invoke his energies in our practice. Please repeat after me. Take a deep inhale. Om Namami Dhanvantarim Adidevam Surasure Bandita Pada Padmam Loke Jararuk Bhai Mritunasham Dhata Ramisham Vividhoshadhinam. Now place the hands over your head. Now, with your two fingers, tap on your palm. Tap on your palm. 1, 2, 3. 1, 2, 3. Tap on your palm. On the other side as well. Tap on your palm. We have few marma points here. And tapping this like this, we are stimulating the marmas on our hand because this is your instrument for the giving the energy healing. Now squeeze your fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you're ready. Now you have to place the middle finger on the Tilarthakala. First, you feel the pulse. And then slowly lift the marma upward. You do not move your finger, you move the skin and lift the skin up, and make sure that your exhalation is longer than your inhalation. Your heartbeat should be slow. Now, repeat this for 2 to 3 times more. Again, release, lift. Hold for a few seconds, release. Hold, lift, and release. Now, let's move to the next point, Hilartha column 2. 2 finger, 1.5 finger upward. So, place the middle finger, index finger, and the ring finger sideways, hold and lift upward. Now, before I move to the next point, there are 2 important aspects of the placement of your fingers. When you place the fingers, you should not never place the fingertips. You should place your finger pads. Chakras, which you can see, the chakras has to be placed like this. You are not going to place the fingertips. Okay, finger pads, the chakras, because this is the position, this is the place where the energy moves from one place to another through this area. तो आप जब इस पे रखोगे तो आपका एनर्जी मूव होगा उस पर्टिकुलर पॉइंट पे या दूसरे पे. ठीक है? Okay. Now, next one is the Brahma Marma. So, Brahma Marma central line on the hairline, and here we do zigzag motion, zigzag. Like, see this very carefully. So, hold here, zigzag motion, not of the fingers, of the skin. You have to move the skin, not the finger. Move the skin, not the finger. I'll take 5 minutes more. All of you can please stay patient, okay? If you do this for 5 minutes, you will sleep very nicely today. Okay, very, very nicely. Just so give me only 5 minutes, and you will see that this 5 minutes will give you 5 hours of sleep probably. Okay, Brahma Marma 2. So now from here, we measure 3 fingers. So from the hairline, we measure 3 fingers. On the third point, again, zigzag motion. Close your eyes and very gentle sideway movement. आपके स्पाइन को सीधा रखिए, ठीक है? अपने कमर पे, अपने बैक पे ज्यादा प्रेशर नहीं देना है, और अपने बॉडी को सीधा रखिए. ऐसे सर को मत घुमाइए इस तरफ या इस तरफ. सीधा रखिए, हाथ को सीधा रखिए. वेरी जेंटल मूवमेंट लाइक दिस. Don't move your head towards this and this side. Stay in the central line. There are so many people kept their videos off. Please show me that you are doing it correctly. I want to see. Otherwise, how will you? How can I correct you? Or how can I show you that if you are not any mistakes? This is the time. So you always keep saying, sir, आप practical कैसे कराएंगे? तो यही तो practical करने का time है. सब लोग अपना वीडियोस ऑन रखें, ठीक है? फिर हम जाएंगे अधिपति मर्मा में. अभी अधिपति मर्मा मैंने पहला one method I have showed you, and that is from the ear tip. We have to slide our fingers in the center, and that brings out the adhipati marma. The other method is to measure 7 fingers. So from the hairline, 4 finger, 3 finger. From the hairline, So start from the hairline. So this is my hairline, 4 finger, then 3 finger, and we exactly reach to the adhipati marma or the Vishnu marma. Here also.
The 3 fingers should be which fingers?
Any 3 fingers. Just take 3 fingers. Okay. 4 finger, 3 finger.
Okay.
I know that sizes are different, but still we'll go with the first 3 fingers. And you see, first of all, when you
4
reach,
and 3, huh?
yeah, 4 and 3, 7 fingers.
Okay.
Okay. तो आप एक ही हाथ को रखोगे बीच में, ठीक है? और उसके बाद zigzag motion करोगे फिर से. Zigzag motion, gentle zigzag motion. दोनों हाथ से स्टिमुलेट नहीं करना है, एक हाथ से स्टिमुलेट करना है आपको. You have to stimulate with one hand only. Guys, everybody, my voice is clear. Is there any break in the video or the audio? Is there any problem with the video?
It's clear.
Okay.
We have to stimulate Adipati with three fingers or one finger?
Three fingers. We have to place the middle finger in the center, index finger, middle finger, or ring finger on the side, and then create the zigzag motion. Then let's go to the Mahesh Marma. So from Adhipati, again 3 finger backwards. Again, we find a depression, the master controller of hormones in the body.
Three fingers, no sir?
3 fingers. Again 3 fingers. And again, you will find a depression. Depression को ढूंढना है. सब लोग डिप्रेशन को ढूंढने में फोकस कीजिए. ये सारे पॉइंट्स में आपको डिप्रेशन मिलेगा. ब्रह्म मर्मा 2, अधिपति मर्मा, महेश मर्मा, सारे पॉइंट्स में डिप्रेशन आता है. Okay, like you can feel the bump here. There is a little very small bump in this region.
That also has to be stimulated with 3 fingers?
3 fingers, exactly.
That also zigzag?
Yes, zigzag motion. You have to repeat all the marmas before you go for the sleep one more time, okay? So that you do not forget. And the more you repeat, the more faster you remember. Now, come to the side of the ear. This is now 2 fingers from the ear tip. 2 fingers from the ear tip. Okay. And what you have to do, again, place 3 fingers, zigzag motion. So here we place like this and move the skin, not moving the fingers. अब मैं अभी भी बहुत लोग मुझे दिख रहे हैं कि they are using, say they are moving the fingers. Moving the fingers. You have to keep the finger fixed and move the skin. Can you see the difference? I'm moving the skin. I'm not moving my finger. It is fixed in this area. I'm just moving the skin. Everybody's there? I'm not able to see any response from anyone.
Yes, we all are there.
Sometimes video is getting stuck. Perfect. Now, when we said this is the controller of the fire element, do not forget this is the point for your high BP. Okay, ठीक है, जो कभी when there is a high BP, sudden rise of high BP, and you will see there is a lot of headache coming in. So you have to don't forget to stimulate this point. This is the immediate release of the headache if you have high BP related issues. Okay, immediate release. Next is the poigai column. Poigai column है आपके कान के अपर अटैचमेंट में. तो आप जैसे ये कान को खींच रहे हो, when you pull the ear, you will see this attachment. So on that attachment, you place the middle finger and then lift upwards. Okay, place the middle finger, lift upwards, and then create circular motion. Lift करना है, lift, hold, lift, and then circular rotation. Am I clear? Lift and then circular rotation. Without lifting, if you do circular rotation, you will not get proper results. Poigai column. Then we have the Shankha Marma. Shankha Marma मैंने बताया था कि आपके आई कॉर्नर और ट्रेगस के बीच में है. तो यहाँ पे हमने एक फिंगर रखा और यहाँ पे हमने एक फिंगर रखा and स्लाइड करते हुए बीच में आगे. We come to the center by sliding our fingers between the tragus and between the eye corner. Okay, so we place our fingers like this and then slide it in the center. So this is our Shankha Marma. जिसको पेट में problem है, stomach issues, problem with the stomach, people with the stomach issues, start doing circular motion and you will see a lot of pain in this area, especially the right side. You will find a lot of pain on the right side.
I have a small question.
Yes.
Which finger should I use?
Middle finger. Middle finger.
I slide it from my ears and I slide it from my eyes. I bring to the center, and then I have to use the middle finger in circular motion.
Circular motion, middle finger.
Okay.
We should not use the index finger alone. Okay, alone we can use with the other fingers, but alone we should not use the index finger, either thumb or the ring finger or the other one. Okay. Yeah. Now the apang marma, x-axis on the eyebrow line, y-axis on the eye corner, and then here when we place our middle finger, very easy to find a depression. How many of you can find a depression? How many of you can find a depression here? Please raise your hands. Very good. Okay, now circular motion, but 1, 2, 3 circular motion, three circular motions we did. Then we have to push it backwards. 1, 2, 3, move backwards, move the skin backwards. Then again reverse, 1, 2, 3, move the skin backwards. Poigai kalam, lift up and circular rotation. Apang marma is circular rotation, push backwards. Apang marma, 3 circular rotation and then push back. Today we gone a little fast because we had covered a few additional topics in the beginning. Okay, but I will make sure that I repeat all of them again and again so that you do not forget. Okay, and you remember, but you have to make a little effort in making no PPT. You have to make the effort. You have to make the effort to remember. Okay, my duty is to tell you again and again and with examples again and again, but without making some effort, you will not be able to. If I give you the PPT, it is easy for me. I can give you the PPT and everything is done. Do I need to do all the drawing and all the hard work again and again? No. Giving a PPT is the easiest thing for me. But I do not want to, do this by, spoiling your, whole concept. When you do part of the process, you enjoy and learn more. Okay. Then the next one, Vidura Marma, last one. So slide, we have to do with the thumb. So press and find where the jawbone is ending and then press inward. Hold and lift up. Hold and lift up. That is the stimulation method for Vidura Marma.
Are we using the middle finger in this?
No, yeah. Thumb. We have to use your thumb. Hold. Jahan pe, wherever my skull bone and my jawbone is meeting, that depression, we have to keep our finger, thumb, and then slowly push upwards. Just lifting it up.
Oh, yeah. The end of the year also comes.
Sorry?
Yeah, the year part also comes. Pull it up.
Yes. And the last one, which we have learned, how to do stimulation of the Karuna Mitra. दोनों थंब को ऐसे पीछे लेके जाइए. ठीक है, दोनों थंब को ऐसे पीछे लेके जाना है आपको. जहां पे आपका स्कल बोन खत्म हो रहा है, wherever the skull bone is ending, then you have to, from the center line, make 1 centimeter away. Both the finger, both the thumb has to move 1 centimeter away. Now, just close your eyes for 30 seconds and observe the pulse or sensation in this point. Pulse and sensation. And very gently move the neck up and down. Very gentle. It is not too much, okay? Just a little bit. See how much I'm moving. Just a little bit. Master controller of the body. Karuna Mitra Marma. Am I clear? So today we can stop here. Today we have already gone a lot. And if you can, see the screenshots. Okay, I will share all the screenshots which I have also taken. If you only go through the screenshots only, you will remember most of the part. You will not forget. Okay. Now, whenever we end the session, we stimulate the Adhipati Marma for the one last time. So what you have to do, place the finger pads, all the finger on the Adhipati Marma. Now keep the back straight, then close your eyes. And we have to bring a feeling for gratefulness or gratitude towards the masters, towards the rishis, or towards all the unbroken chain of our gurus through whom we are receiving this energy healing modality and this beautiful knowledge system which can heal us without any other issues. When we remember them and feel grateful for them, it helps us to connect with their mind and help us to remember all these things very easily. Now, bring your both the hands to the prayer mudra, and thank you so much for everyone. All of you have attended the class. I think 40 plus people, 45 people have already joined and 40 people attended, which is very, very good. I will try my best to make sure that all of you learn very well. Okay. Just one request that please ask your questions during the class, okay, not after the class, because I have so many classes and hundreds of students. So if everybody keep asking a question whenever they want, it becomes a little difficult, because I really do not want any unquestioned anything which you send and I'm not able to answer it in time. It feels very bad for me that I'm not able to answer you. तो आप लोग कोशिश करें कि क्लास के टाइम पे ही सारे क्वेश्चंस को मतलब पूछ ले, ताकि और अटेंड करें क्लासेस. डोंट मिस द क्लासेस. इवन इफ यू मिस 1 or 2 classes, it's okay, but at least try to attend 70-80% classes. Okay, so thank you so much everyone. I'm very happy that all of you have attended, and I'm very grateful to all of you for being here and staying patient for the class. Okay, see you all tomorrow. Thank you everyone. Good night.
Thank you.
Hari Om.
Thank you.
Take care.
Hari Om. Shall we get the recording to see again?
Yes, I will share the recording. I will share the recording.
Thank you so much.
Thank you, sir. Thank
Good
you.
night,
Thank
sir.
you. Good night.